Please join me in a really warm virtual welcome for Dr. Lynn Silver. Thank you, Dr. Silver.
Thank you, Charlene. It's a pleasure to be here with San Mateo again. I had such a good time on the first call that we did with people from your educational system. So it's really nice to be back with a diverse group tonight and to talk about this subject, which is near and dear to my heart. So just first of all, our project is called, it's part of the Public Health Institute. The project on cannabis specifically is called Getting It Right from the Start. And really we started when Prop 64 passed in California because we were looking at the legalization process and saying, hey, you know, whether you're for or against legalization, it looks like we forgot almost everything we'd learned from tobacco control in other areas. And we need to apply some of those lessons to the cannabis legalization process to make sure that we protect kids and protect public health. So since that, we've worked with over 100 jurisdictions in California, with states around the country and even some other countries. We produced model laws that I'll show you for California, cities and counties, to other tools, and tried to work to make the process in California and nationally be more friendly to protecting kids and public health. We've had some successes, some failures. I'll share some of those with you tonight, and try and suggest things that you can do as citizens in your communities to help address some of these issues. So first of all, I think a good question to start off with is like, okay, why did we want to legalize recreational marijuana? What was the motivating factor behind that? One thing you can say is, okay, it may have been to provide legal access to a product that is not healthy, but was previously illegal, but also creating major problems because of the illegality. Did people vote for legalization to maximize profits for the cannabis industry? Did they vote for it to maximize tax revenue? What is behind cannabis legalization? I will give you sort of my take on what I think the goal should be if a community is legalizing. And really legalizing has two different components to it. One is ending the criminalization of cannabis for possession and for minor crimes, and the whole war on drugs approach that put so many people in jail and created criminal records and many other problems. If we're creating legal access, I think our goal should be to create legal access, but without driving up consumption, and especially harmful patterns of consumption, without increasing use by our kids or by pregnant women, and without really driving up negative consequences of use, such as mental illness, accidents, suicides, and so on, without driving up the cost to society of dealing with all of those complications or adverse effects, and without making things more inequitable than they already are. So how are we doing on those goals? And that's some of what I'll try and talk to you about tonight. Really, one area where we've made a lot of progress was the goal that was touted by many during legalization, which is to reduce mass incarceration related to cannabis. And we really have over the past, well, now we're in 2023. So since 2000, just between 2009 and 2020, we saw a 96% reduction in arrests related to marijuana possession in California. So that I think is really a major social success when we think about it. Decriminalization, and then this was followed by a process of automatically expunging people's criminal records. It wasn't actually in the legalization proposition, but subsequently when it was realized that almost nobody could actually afford to pay a lawyer to get their criminal records expunged or even knew about the possibility, the state moved to doing an automatic process of expunging the criminal records of people who'd been arrested for marijuana possession. And that really can help many people apply for housing, get jobs, not have to say they have a criminal record because they had a joint in their pocket at some point. So that has very major social and equity benefits. And I would say it's the really positive side of the decriminalization process. Now, you don't have to legalize sale or open stores to get these benefits, but they went hand in hand together in California. But now let's look at other aspects of what happened. What's being sold in our state? Where is it being sold? What do we know about the health impacts so far? And what can citizens like yourselves and local governments do to sort of balance the costs and benefits of legalizing cannabis? So first, let's talk a little bit about what is being sold. And, first of all, what's being sold is more. So we've seen a very rapid growth of the legal cannabis industry over the last 5 years. You would expect that because whatever was being sold illegally, some proportion of that is transitioning to the legal market. That's that blue curve on the left. And as you can see, between 2018 and 2021, it really, just went up precipitously. And then with the pandemic, it started leveling out. So it's not growing as fast anymore. We don't know if it's going to start growing again after the pandemic, or if it's just sort of reaching the level of consumption of a more stable legal market. At the same time, what we've seen is growth in certain sectors, and the sectors that are growing really fast are what we call concentrates, and also other products that are being manufactured that are not traditional cannabis. So really, when most people voted for legalization, they were thinking about the joint that they smoked in a party, or that they grew up using, or that they saw being smoked in their neighborhood. When I went to college, which was quite some time ago in the 1970s, a joint was probably about 3 to 5% THC. THC is the active stuff in marijuana that gets you high. CBD is another one of the major ingredients, but THC is the stuff that gives you that sensation of being high. But what we have out there today bears relatively little resemblance to what was in marijuana flower when I was growing up, when your parents were growing up, or I don't know how old the people on the call are. This led our former Surgeon General to, basically characterize the situation as it's not your mama's marijuana, which pretty succinctly covers it. Flower, the stuff that you smoke in a joint, has gone from about 3 to 5% to about 16 to 30% THC now if you go into a dispensary. So it's, 5 to 10 times as strong as the flower that they had when I went to college in the 1970s. It's still the cannabis product that's the most purchased by young people. But in addition to selling marijuana flower, there has been the development of an entire parallel industrial sector producing all kinds of things that have the active ingredients from cannabis, but are really nothing like the good old-fashioned botanical plant. So we have industrial cannabis that's extracts through chemical processes these active ingredients, and they've made dabs and vapes and waxes and oils and butter and resin. And some of those products have as much as 99% THC. So shatter, for example, and other products that are used for dabbing can be almost pure THC. Vaping cartridges, 70, 80, 90% THC. And then we have another sector separate from these concentrates, which is the edible sector. So it's not as strong as concentrates, but it's this kind of whole supermarket of luscious, delicious, attractive products that make people want to eat them, including kids. And so all of this new industrial cannabis sector really doesn't look a lot like what people thought they were legalizing when they voted for legalization of marijuana. So on the left, you have flour. Here are some of the highest concentrates, butter and shatter. Shatter looks like glass. That's why they call it shatter. There's all kinds of vaping products. You can vaporize flour, but then there's these chemical extracts that are used for vaping. And the kids love vaping products because they don't smell like pot. So you can go to school and vape cannabis in the bathroom or in the yard. You can vape cannabis at home, and people will not necessarily smell that typical smell of cannabis or have any idea that you're getting high. which makes it a big problem. So we have a significant number of kids who are either going to school high or getting high at school, interfering with their ability to learn, obviously, and again, of course, at home. And principals, are confiscating vaping devices, having to worry about what's happening in the bathroom. Parents are seeing this. Many of these devices look just like memory sticks or car keys or all kinds of things. And that has created problems for school. Then we also have hash and quiche and a number of other very high THC content products. So these are products that can get you really high. The edibles is widely varied from, chocolates to Rice Krispie bars to cookies. Whereas in some states, each edible has to be like a separate physical unit. In California, unfortunately, they allow a single cookie to have 10 doses, or a single can of soda like this pina colada to have 10 doses. So if somebody does a really normal thing, which is to eat the cookie or to drink the can of soda, they will get very stoned. So some of them only have 1 dose, but some have 10. So many kids and also adults are getting a lot more stoned than they want to get and getting into trouble because of the lack of clarity of what an appropriate dose is. And then many of these products are really imitating names of candy bars, of other products marketed to kids. I don't know if you can see this. You probably can't see this one, but this one is 30% flour 30% flour that called Cocoa Pebbles, and it has pictures on the front that look exactly like Cocoa Pebbles cereal. I'm blurred, so you're not going to see that clearly, but I think I have a slide later. And, just so many products that look and sound like typical foods. Some of them are illicit market products, but also many products. I've found hundreds of products being sold on the legal market with names that imitate common foodstuffs. So I don't know how many of you worked on flavored tobacco issues or, read about Juul and how flavored Juul e-cigarettes have hooked kids. The state of California just prohibited flavored tobacco products. They actually did it a year ago, and then the voters reaffirmed that law in November overwhelmingly, because there's lots of good evidence that if you sell a product like a vaping product that calls itself mango vape or strawberry vape, a 17-year-old, a 16-year-old, even a 20-year-old is a lot more likely to start smoking or start vaping using that product than if it has just a tobacco or a cannabis flavor. The presence of particularly sweet flavors, very attractive to our kids. They make kids think that the product is safer if it's named, if it has a fruit name, it seems more benign. And in the case of tobacco, about 80% of kids who start smoking started until this prohibition this year with flavored tobacco products. So we had this really crazy situation in California. We were banning flavored tobacco products because we know they hooked kids. States doing media campaigns saying flavors hook kids, and discouraging flavored tobacco products. And then we were legalizing the cannabis industry. And instead of learning from what we already knew from tobacco, which is not to allow these flavored products, they went ahead and legalized the flavored products for cannabis for 5 years. This is getting a little better. The state took the first baby step this year to say you couldn't add flavors like grape or cherry to cannabis inhaled products, but they did it in a very sort of weak and halfway way. So whether it's actually going to be enforced, I'm not sure. I think it's going to require a lot of local vigilance and enforcement to make sure that these products are not hooking kids in the cannabis from cannabis in California. But like, here's an example. They sell a blunt and wrap it in a wrapper that's flavored like grapes and call it a grape blunt. There's also these products that are targeting kids who, identify as gay or as lesbian. Plus Pride Rainbow Sherbet, obviously trying to capture the LGBTQ sector. This is almost identical to what Juul was doing. This is a Stilsy grape flavored vape. It's very, very potent. A single, container of many vapes are really almost the equivalent in intoxicating doses of a keg of beer. Just to give you an idea, the number of, equivalents of a glass of beer in terms of doses of cannabis in one teeny little vape cartridge can be basically a keg of beer. Then we're seeing out on the market this whole other phenomena that's called hemp. So what's hemp? This is really confusing. You've got cannabis, which is marijuana, and then people are talking about hemp. So what's hemp? Hemp is the same plant as marijuana. It's Cannabis sativa, exactly the same plant. But in 2018, the Farm Bill said if you grow Cannabis sativa, or the cannabis plant, with less than 0.3% of the active ingredient that gets you high in cannabis, THC, it's legal. So whereas cannabis federally, nationally in the US is still illegal, hemp, these cannabis plants with low THC became legal. And people justified that by saying, well, there's all kinds of other products that come from hemp, like rope and certain kinds of clothing and hemp protein, which are fine. But it also produces CBD, which is being used as a sort of medicinal product, often for unproven uses. In some cases, it has some proven medical uses. But then the industry got but the idea was you could sell CBD, but you couldn't sell the stuff that gets you high. But then the industry got really chemically creative and started creating a whole bunch of THC-like compounds, Delta 8, Delta 9, Delta 10, and selling them outside the cannabis market all over the place. And so we're seeing a crazy proliferation of these hemp products. In addition to California having its legal cannabis markets, if you go into vape shops, smoke shops, convenience stores, you will see hemp products, some of which are very, very intoxicating. This was made worse 2 years ago when a bill called AB 45 passed, which basically said it's okay to adulterate food or sell supplements in California that contain hemp. They put no age limit on it. So these products are legally available to kids across the state right now. And none of the regulations addressing the issue, like age limits or limits on THC content, have been issued. So we are seeing products with huge amounts of THC or THC-like compounds that get you high, being sold all across the state where kids can get them. This is one I bought a couple of weeks ago in Woodland near Sacramento. So a legal cannabis product, the edible that you can buy in a dispensary, can only have 10 milligrams of THC per dose, 100 milligrams in the package. Some states use 5 milligrams and 10 and 50 milligrams in a package. This package I bought in Woodland of the hemp edible, it was 10 worms. Every single one of those worms had 100 milligrams of what's called Delta 8 THC, which is almost the same thing as Delta 9, the traditional THC. Shaped like Sour Patch Kid gummies, so in nice bright colors. So obviously it's going to attract little kids. And it was available in the local smoke shop. Anyone, any age could go in and buy this. This would knock me flat on my butt. If you were an old lady, it could really put you out. And if you're a elementary school kid or a junior high kid, one of these gummies would knock you out. And yet they are available widely. And there's just a whole range of these hemp products, very attractive to kids in a very unregulated space, in addition to the cannabis market issue. Principals, we're seeing incidents in schools where a bunch of kids are getting into one of these bags, either realizing or not realizing what they actually are. Kids passing out in school, getting taken away by ambulance. There have been at least 4 or 5 of those incidents recently. Where is cannabis? So going back to cannabis, what's legal weed in California, where is it being sold? You may hear in the press stories saying, oh, it's terribly difficult to get cannabis, not enough places are legalizing it. They're pressuring to make it, to override what was promised in Prop 64, that your local city or county could decide whether to legalize or not. In reality, the market has grown pretty steadily. These are the number of retailers in the state, and it's just every year grown steadily. We're up to just under 1,500 retailers a year ago. Oh, actually, I need to update this. We have more now. But it's continued to grow, both the delivery sector and storefront cannabis dispensaries. Most Californians have legal access now. So legal access means so you can grow your own anywhere in the state. You can possess cannabis in modest quantities anywhere in the state. But local government had the authority to say whether or not you could open stores in your city or county. So not all of them opted to allow sale of cannabis in their jurisdictions. And some said, okay, you can't open a store, but a company that delivers can deliver here. And then others said, no, we don't want anything. But 61% of Californians now lives where some form of retail sale is legal. That's about 289 of our 500 and some cities and counties. And then even the people who don't live right where you have legal sale, many of them are actually a pretty short drive from a city or county or an unincorporated area where there's a legal storefront. When we look at pregnant women in California, even those who said they lived where it wasn't legal, basically 3/4 of them live pretty close to someplace that was. And that makes a difference, like how many stores there are near where you live affects how likely people are to use, including using when you really shouldn't use. So cannabis should not be used when someone is pregnant or breastfeeding. It passes to the baby and it has a number of negative effects. And we found that, the likelihood of a woman using during pregnancy was like directly proportional to the number of retailers, within a 15-minute drive from her house. So if you're in favor of legalization, you want to provide legal access, but you don't need, more dispensaries than Starbucks. You don't need more dispensaries than grocery stores. You don't need one on every corner. You need a few, maybe one per 20,000 inhabitants or so. I live in a town with 110,000 people, and I think it had 6 Starbucks and 9 grocery stores. There was a proposal at one point to open 33 dispensaries in my town, which just would have been ridiculous and unnecessary. You'll hear a lot of talk about the illicit market versus the legal market. The illicit market is a big problem in California because California has for many, many years been a major pot producing state and also a major center of export, sending pot to other states. So when we legalized, at the same time as the legal market was being created in the state, that overproduction that supplied much of the United States didn't disappear. And in fact, because the penalties had become less severe for producing even illegally, cartels moved in, and there is a significant amount of new illegal production, much of it going to out of state, some of it dangerous people, really severe exploitation of workers, human trafficking, water theft, and environmentally damaging practices. At the same time, we can't solve that by getting rid of taxes or just making it really easy to sell legal cannabis in the state, because we're producing much more than what California currently consumes. So we don't want to solve that problem by taking those extra millions of pounds and pushing them on our kids or even our adults, because that would just drive up harmful consumption. So the illicit market is a problem. It's going to take time to resolve, and probably changes across the country and what's going on. But we also won't solve it by not being careful how we allow the legal market to function, because really the major driver and problem of the illicit market is that we're just producing more than we need for the state at this time. So let's talk a little bit about health impacts. How does cannabis affect health and our kids' health? You know, is it healthy? Is it a wellness product? You know, like the industry is telling us it's a wellness product. I don't think it's a wellness product. Even if they put it in the gift bags at the Oscars, which they have been doing. It does have some proven medical uses. So if you're getting chemotherapy, it is effective for chemotherapy-induced nausea. If you have a child with certain severe forms of epilepsy, which are relatively rare, Lennox-Gastaut, a couple of really crazy bad epilepsy syndromes, CBD can be helpful, and it's approved by the FDA for that. Certain forms of chronic pain respond to cannabis. If you have multiple sclerosis, cannabis can be helpful. And there's the research is just really accelerating. We'll probably find more uses, medical uses for cannabis, but we still have a lot to learn as well. But there is also a lot of very clear evidence of harm, and I'll get into those in a little more detail. Harm to babies who are exposed when their mother consumes when she's pregnant, increased car accidents, lung disease if you're smoking over time. One of the ones that concerns me the most, and I'll get into in a minute, is increases in psychosis and schizophrenia. Addiction or problem use, which is more likely to occur if you start early and use frequently. There's increasing evidence of increased suicide risk, and as many of you may have heard, suicide rates are way up across the country and in our teens, and so that's particularly concerning. There's something called cannabis hyperemesis, so very severe recurrent vomiting that's occurring with people who use regularly, especially these highly potent compounds like vapes, but also some other products as well. Often just develop really bad cyclical vomiting, sometimes only alleviated by taking hot showers, which is a really crazy thing, but it's very clearly associated. It's called cannabis hyperemesis syndrome. Cannabis affects brain development, and really the periods that are most sensitive are pregnancy, early adolescence, and young adulthood. During when a baby is exposed during pregnancy, it increases the risk of low birth weight, prematurity, and what's called being small for gestational age. But many times those things can resolve shortly, you know, as the child grows. But the evidence that's emerging now that's more worrisome is these big national studies looking at how learning capacity of our children is developing. It's looking at what they call adolescent cognition. And this is a big study that's going on across the country, supported by the National Institutes of Health. And their first two rounds have been 2 rounds of this research on cannabis now, looking at about 11,000 kids. They started when they were 9, and they're following them. And we had the next publication at age 11. And about 6% of them had been exposed during pregnancy to cannabis. And really, they found significantly greater problems in the neurological and psychological development of those children who had been exposed to cannabis while their mothers were pregnant, including psychotic-like episodes, changes in cognition and learning, breaking rules, aggression, social problems, obsessive compulsive behaviors, and attention deficit. And they came back and looked at these children again a year later, very similar findings. So this to me is really worrisome. We're telling use during pregnancy almost doubled over the last decade in California, from about 4 to about 8% of pregnant women, and it's much higher in young mothers. So if this has longer lasting effects on the children, you know, that's really worrisome, because as I think of it, the baby can't unring that bell. You know, if you're an adult, you develop a problem, you stop using, you can generally reverse those effects, not always. But a baby who's been exposed during pregnancy cannot undo whatever long-term effects this may have on their development. And so that's really concerning. Cannabis also impacts how our kids do in terms of education. This is actually a study from New Zealand, but they followed several thousand kids from age 17 until they turned 30 and looked at their educational outcomes and some other outcomes. And really they found that depending on frequency of use of cannabis, how they did in terms of education just varied enormously. If you were using cannabis every day, the likelihood of graduating from high school fell by more than half. Pretty much the same pattern for college. It didn't seem to affect depression, but it did make you more likely to be dependent on welfare by the time you were 30. So, I think most of us in our communities are fighting to try and make sure that every kid graduates high school and if possible college. And this is something that can really have a negative impact on those outcomes and that many kids are not aware of. So many young people are, smoking weed to deal with stress, to deal with mental health issues that they're feeling, believing that it's a wellness product, that it's safe, that it's natural. And yet this, for many of them, it can really have quite significant negative impacts in their lives. We're also seeing big increases in accidental ingestions in little kids because so many edibles are being sold that look just like candy and gummy worms, some of them like Doritos, Cheetos. The poison control centers in our emergency rooms are seeing large numbers of accidental ingestions. Actually, in very young kids, I think for Rady Children's in San Diego, the average age was 2. And of the kids that came to the emergency room, about half of them were hospitalized and a significant number required intensive care. There haven't been a lot of deaths from these. I'm aware of one, but still they can be very, very scary and require mechanical ventilation, for example. In terms of overall ill effects, young people are really at the greatest risk of ill effects because the brain doesn't really finish growing up until they're about 25, but brain maturation continues, not just in adolescence, but until you're really a young adult. And yet our Gen Z kids are the most likely to be purchasing these higher potency products, concentrates, and vape pens that have significant effects and increased risk of addiction. So these higher potency products make you more likely to get addicted and develop cannabis use disorder. Using cannabis over 10% THC, which is almost our entire California market now because the lower potency stuff is disappearing, can increase your risk of developing psychosis 5-fold. And this can range from just kind of transiently hearing voices or seeing things, and then it goes away as the cannabis exposure wears off, to actual severe psychotic breaks that last for a long time, and development of full-blown schizophrenia. Some of these young people may have developed schizophrenia anyway, and cannabis use may be a triggering event, but many of them may not have. It does seem to happen more in people who may have a familial risk or predisposition. But, it's probably a reasonable piece of our total burden of people who are developing psychosis and schizophrenia may be due to high potency cannabis. In Europe, they've estimated about 1 in 8 cases. Cannabis use disorder, which is, dependency, happens in about 9% of people, 1 in 10 people who start using cannabis, but it's more likely in those who start in adolescence. So if people start smoking weed when they're 15, 16, about 1 in 6 may develop cannabis use disorder. And what is that? It's not like opioid disorder. It's, opioid addiction. It's not that dramatic, terrible, painful addiction that all of you know about. You don't die from overdoses in the same way from cannabis either. But cannabis use disorder is real, and it really can interfere with people's lives. It can interfere with their schooling, their personal life, their work life. It can cause distress. It can lead people to do hazardous things and put themselves in dangerous positions. There are real withdrawal symptoms, cravings. It can use up people's money and their time in ways that they perceive as not helpful to their lives. So these patterns aren't without consequence. We've seen in the last decade tripling of the number of California adults who are using cannabis every day or nearly every day. Use nationally by young adults and daily use have skyrocketed, and use by pregnant women has gone up quite significantly. We're seeing increased car accidents with cannabis. If you use together with alcohol, that really increases risk, especially if you're, a young, inexperienced boy driver, particularly. The impairment of driving can last longer than intoxication can, and can even occur with people who use regularly for medical reasons. Law enforcement, there's not a good test that correlates exactly, how much cannabis in the blood means how much impaired driving. So officers generally have to do what's called field sobriety tests, the kind of traditional thing, walking, seeing, how stoned you are by observation, more than by blood tests. And then, people who develop psychosis, if someone's psychotic from cannabis use or paranoid, they may jump in a car, drive inappropriately, get in front of a car and get killed. So these symptoms of psychosis, why they don't normally kill you directly, they can kill you indirectly because of the things that you may do. I've heard about young people drowning because they develop cannabis-induced psychosis, having car accidents, and many other negative events. One thing people don't think about, we are seeing, and this is what I'd call emerging area, it's not as clear, but evidence of heart attacks and strokes increasing with cannabis use. The data is still coming in on this. So the idea that if you're 60, it's perfectly safe to smoke cannabis every night to go to sleep. If you have heart trouble, think twice about it, talk to your doctor. I don't know how many of you have them, but there's just an increasing number of stories of kids, 15, 18, 20, college kids, working kids, who have started using cannabis and had really problematic shifts in their life, particularly if they develop psychosis, and often not realizing that it may be associated with the cannabis. I heard just this week from one of my colleagues, her son was at college, came home with psychosis, hearing things, seeing things, was diagnosed with manic depressive disorder, was home using weed every day because he was scared and upset. And really, it turned out that the kid did not have manic depressive disorder. What he had was weed-induced psychosis, stopped using the weed, got better, hasn't had any more problems, went back to college and graduated. That was a good outcome, but we also are aware of many stories, some of them documented in this quilt by mothers, of people who developed psychosis, became homeless, committed suicide, had car accidents, and outcomes that were much worse. One question you could ask is, does cannabis give you cancer? Unlike, the good news here is that unlike cigarettes, it does not seem to cause lung cancer or head and neck cancers, but it may cause testicular cancer in men. So that's one area where it's really different. But so as a result of all this stuff that we're seeing a lot more people landing in the emergency room related to cannabis. It's gone up in just 3 years. It went up by 54%. That's a lot, many for psychosis, delirium, severe vomiting, or accidental poisonings. Some of these health effects can really exacerbate inequities. So while we think about equity in cannabis, we think a lot about, okay, who owns the store, who gets the licenses, who gets the money to benefit from the cannabis economy. But we also have to think about, how does this affect health disparities that we already have, like low birth weight in Black women, disparities in educational outcomes, or in mental health for our young people. Most people are not aware of the harms, and that makes things worse. In Canada, for example, every package of legal cannabis has really clear warnings. For example, this warning about psychosis, but in California, they have no warnings about mental health effects. And that is a problem. We tried to pass a law last year, and we were blocked by the industry in passing that. In California, the health warnings are small, illegible, buried on the back of labels, impossible to see. So what can you do about this? I'm going to spend the next few minutes just talking about things you can do and then have some questions. There is a lot you can do. Your local government, the state legislature, and agencies can address all these issues more effectively. Schools can take some steps, although it's more challenging. But California cities and counties can limit the number of retailers. You can say how far the stores have to be away from schools and homes and universities. You can keep the stores specialized and not let them turn into lounges and restaurants and hangouts. You can respect smoke-free air and not allow cannabis events in your park, in your parks or at your concerts or at your beaches that are going to end up normalizing cannabis smoking. This is just an example of what's called a temporary cannabis event at a concert, and these are becoming increasingly frequent. So parks and beaches that we made smoke-free years ago and have been smoke-free for years are now, many of them having a lot of cannabis smoking going on, especially during events. So really you can say no to treating cannabis as the best thing since sliced bread. Don't allow on-site consumption lounges in your city. Don't allow other products to be sold like branded clothes that we know attract kids. Your local government can say no to allowing the sale of these hemp products that kids can access. And we would very much urge communities to take action to stop intoxicating hemp products that can be sold to kids that are all over the place right now. Contra Costa County said no flavored inhaled cannabis products, and they also said no vaping products. Pasadena and other cities said no to cannapops, these like sugary sodas with cannabis in them that we know will attract teens as well. Other places are limiting the potency of the products and requiring stocking of lower potency products. Local government can require cannabis dispensaries to inform consumers about the risks and give them information, which San Francisco is already doing. You can require warnings on ads, which New York State has done. So these are things you can do locally. You can inspect and enforce better, make sure that it's not being sold to kids. Your city or county can require warnings on ads. It can ban billboards, and it can enforce the existing restrictions. For example, billboards on state highways are not allowed, and yet we see them all over the place. Local government can tax cannabis, and it can take that money and use it for youth programs, for substance use prevention, for other social equity issues. And yet that's not happening very much. Taxing is happening, but not too much of the revenue is really going into keeping our kids healthy and preventing problems. Local government can also act to limit overproduction by deciding how much production to allow. Local government can promote economic and health equity. You can say we're only going to license equity applicants, and you have to hire to promote equity. And you can monitor marketing and make sure that marketing is not pushing cannabis in our low-income communities and communities of color. Community members and local government can come together to fight for the state to put the guardrails in that we need, like stopping products that are attractive to kids, stopping these intoxicating hemp products, and taking other actions. I'm just going to show you some tools that we've developed to help communities. One of them is the local policy scorecards, and these are available for every city and county that allows cannabis sale. These are maps of better practices that local communities have implemented. I'll skip this one. But most communities are really not using the power and the authority that they have to protect their kids and public health. In San Mateo County, the scores for your communities are pretty darn low. This is the list of places that allow some form of cannabis, either through delivery or storefronts, and your scores are very low. Some positives are there's mostly medical delivery where it's allowed. There's some local licensing. There's some local taxes. Pacifica said no to these temporary events. Burlingame said you can't deliver to places that serve kids or public parks. Pacifica, Daly City, and Redwood City don't allow on-site consumption lounges. So those are some positive things. Unincorporated San Mateo County, very weak. provisions. It does limit billboards. Other cities just got like 3 points in 100. All of these are available on our website for every city. Pacifica did the best in the county. They have a tax. They prohibited temporary events. They prohibited on-site consumption, limited billboards, and took some other actions. Burlingame got the most improved prize, and they took some measures. There's still a lot more they can do. These are some of our materials. This is model laws for local communities. If you want to take action in your community, please reach out to us, to my colleague N. Shahidini or myself. We will do what we can to help within the limits of our capacity. Talk to your city council members and county supervisors. Let them know that you care about this issue and that it's important for them to take action, because they hear almost exclusively from the cannabis industry and very little from concerned parents, teachers, and others. And as San Mateo County residents, you have a unique opportunity because your Assembly member, Mark Berman, chairs the Assembly Business and Professions Committee, which is the committee that addresses cannabis policy. Last year, he actually greatly weakened the bills to inform consumers about cannabis. This year, there will be work being done to try and get rid of those hemp compounds that are accessible to kids and to limit products that look like candies and attract kids. So let him know that you care about this and you want to see action to protect kids from cannabis candies and from hemp. This is not lobbying because these bills don't exist yet. So I can say this, but you can call or email his district office in the next 2 weeks and tell him that you care about protecting kids. I strongly encourage that. So better outcomes from cannabis legalization really needs you at the table. It needs parents, it needs teachers, it needs other people speaking out, and then we can all learn together how to do this better. Thank you. Boy, I talked a long time.
Thank you so much, Dr. Silver. We do a lot of educating around cannabis and substances, but you have taken it to a whole new level. So thank you. Thank you for everything tonight. We have a lot of really good questions coming in, so let's see what we can do. Okay. Here we go.
Let me unshare, I think.
There you are.
Oh my God, 40 in the chat. Wow.
Yes. So I want to just kind of go down the list, Lynn. Let's see how we can do. Question: are the hemp variants available just in states that have legalized marijuana, or are they US wide?
They're mostly US wide unless the state has taken action to stop them. So states can take action to block them. But there's a lot of legal debate about how much they can do that. But it's a national problem. It's not just to states that have legalized cannabis.
Okay, thank you for that. Question: in addition to higher THC doses, I'm hearing that cannabis is becoming adulterated with other drugs such as fentanyl. Can you comment on that?
There have been a few reports of fentanyl contamination of cannabis that I heard from the high intensity drug trafficking area, but not a lot of confirmed ones. So I don't think it's been a huge problem, but it is a reason to, if you are going to purchase cannabis, buy it from the legal market. You will have much less risk of something serious like fentanyl contamination, and you will also have less risk of contamination from mold or pesticides. And other types of contaminants. The testing that's done in the legal cannabis market will protect you from those unwanted contaminants. What it won't protect you from is the stuff that they purposely put in there, which is very high levels of THC. So most of the adverse health effects come from what is intentionally put in the cannabis, which is often excessively high THC. But the things that are unintentional, you will help avoid by purchasing on the legal market. So if you're going to smoke weeds, buy it on the legal market.
Okay, thank you for that. Dr. Silver, there's a number of questions coming in about medical marijuana. Parent asks, are there any situations where medical marijuana used by teens is appropriate?
There are probably some. If a teen is getting chemotherapy and has severe nausea, if the teen has one of these unusual forms of epilepsy that doesn't respond to other treatments, if the teen has multiple sclerosis, spasticity, for example. But there are other situations where you probably don't want to treat with marijuana. You don't generally want to treat psychosis or schizophrenia with marijuana. You don't want to treat depression or suicidality with marijuana because it may make it worse. You don't, I think, want to get your kids used to treating stress with marijuana. You need to find other healthier approaches to building their life skills in dealing with stress and their capacity, and using mentoring and other approaches to help kids who are resorting to marijuana use as their way of dealing with stress.
Okay, we continue to hear, especially from the teenagers, that it's natural, marijuana is not addictive. I think you are pretty clear on that, but could you just state for the record, Dr. Silver, whether or not cannabis is addictive for kids?
Cannabis is addictive. It's more addictive the younger you are. That is not Dr. Silver. That is the National Academies of Science conclusion in their very, very extensive scientific review of the issue a few years ago, in 2017. So there's general consensus in the scientific community that cannabis is addictive. Like I said, it's not addictive like opioids. It doesn't give you that terrible, horrendous withdrawal that you get with opioids. But it definitely can, and most people don't become addicted. But for a significant minority, 10 to 17% or so, depending on the age, do develop dependency, and then it can really mess up your life. So yes, addiction is real. It's different than other drugs, but it's real.
Okay, thank you for that. Here's a good question. Can you please share your thoughts on a regulated via potency cannabis market statewide?
When we have a regulated market, I believe that it's very poorly regulated, that the state of California has done very little to regulate the nature of the products. So whereas some states have pre-approval process to make sure that products aren't attractive to kids, some states taxed based on the THC content to discourage high THC. Connecticut, Vermont, New Jersey put hard limits on the THC content. Uruguay only allows 9% flower. Israel is 12%, I think, 12 or 21%, but the flower that's in a dispensary today is like 20, 30%. So a number of places have put harder limits. We don't know the best approach to dealing with the potency issue. Like, you don't want people cutting a vape cartridge with other stuff to dilute it because of a potency cap. So I think everyone's trying to figure out what the best approach to the problem is. I would say we would want to limit the potency of flower, have edibles be 5 milligram doses that are physically separate, and have concentrates be limited the amount of grams of THC you can sell, and probably not even allow certain forms like shatter. But I think one of the real challenges is we're all trying to figure out what the best way to, where to put the limit. Everyone knows it's a huge problem, and where to draw the line is an area of uncertainty. But basically, start low, go slow, use lower THC products. The lower THC, the safer.
All right, when you're talking about 3% versus 99% potencies, that was pretty shocking. Yeah.
They're very different. They don't act the same way on people.
Oh, goodness. So here's a great question. We have just a few more minutes together. So maybe one and then a final thought. What can the schools do to clarify the misinformation kids hear from their peers about cannabis?
I think, there's some basic education doing some of this, but peer counseling can be one of the more effective strategies. Having kids who've been through some of this talk to their peers often has more credibility than a teacher's lecture. But getting them some basic information can definitely be helpful. There are media campaigns and having good media available to people that gets across some of the basic lessons can be helpful. There's an increasing number of campaigns available that schools can share with kids. But I think also just general supportive programs for youth, especially vulnerable youth who are facing stresses and facing other issues, is a fundamental part of substance abuse prevention, really helping kids deal with whatever the life circumstances and conditions are that are driving them to substance use is often critical. But some of the reactions, like the kid who's going to become paranoid or become psychotic with cannabis, is very unpredictable, and you don't know who that child is going to be. It's, I've heard many stories of kids from very stable, well-resourced families who were doing well, who were the person who had that predisposition to have psychosis or schizophrenia. I see a question in the chat about that. The data really does suggest that it increases the rates of psychosis and schizophrenia beyond what would otherwise occur. At the same time, that may be happening in people who have a greater genetic predisposition. But most people don't know if they have a genetic predisposition, and many of the people who have a genetic predisposition would not go on to develop the illness. So it appears to be like an interaction between being exposed to whatever is triggering in cannabis and having some intrinsic risk or genetics. But that doesn't mean that you can just blame it on the genetics and say, oh, they were going to get sick anyway. That's not the case.
Okay, so, we have had so many wonderful questions coming in, and audience members, I know many of you are parents and health professionals and concerned community members, wish we could answer them all. But Dr. Silver, we know as parents of teens that just say no and negative campaigns don't work. What are your final words for how best to get this message as a parent across to your child? I know it's a big question.
Yeah, it's really hard. My kids used weed too. They tried it. I think I gave them at least enough to know that it had the potential to be harmful. Mm-hmm. When I saw people getting in trouble with it, we discussed it. So like if there's someone in your circle or a friend, I think talking about that and how that's affecting the person's life in negative ways can be an effective lesson. I think engaging kids in activism and being part of being the solution can be very mobilizing. We've seen that a lot with tobacco. Having kids be part of youth engagement programs that do education, but also take action in their communities helps build their skills, and also play a role in prevention and educating peers. So I think, bringing in kids and involving them can be some of the most effective stuff, but there's not an easy answer. And also, in anything you can do in your community to keep your kid from being surrounded by advertising, billboards, things that don't have to be there in your community, will make them also less likely to be responding to those cues.
Well, those numbers in San Mateo County don't look so good. We have a lot of work to do. Thank you, Dr. Lynn Silver, for an amazing presentation tonight. I know that everybody will want to watch this video and share it with others. So again, we are so grateful to you for everything tonight, taking your time and really just giving us such a robust presentation. Thank you. Okay. All right. Take care, everybody. We hope to see you again soon. Thank you, Dr. Silver.
All right. Take care. I hope you all become activists on this. We need you.
We do too. Thank you, everyone. Thank you for joining us tonight.